Welcome back, dear viewers, and our first guest of the evening is Dr. Ahmad Esmaeel, specialist in endocrine, diabetes, and metabolic disease. Good evening, Dr. Ahmad. It's really a pleasure to have you with us on Hala Kuwait.
Good evening. Thank you so much for the invitation.
It's really a pleasure. So, Doctor, we're wondering about your job, and tell us what kind of patients do you see mainly?
Okay, so I work in Jaber Al Ahmed Hospital in the unit of endocrine and diabetes. So mostly we see patients who have endocrinological problems. So any health issue related to too much hormones or too little. So most of the patients we see are patients who have diabetes, obesity, an overactive thyroid, or maybe even underactive thyroid.
Okay, so doctor, you mentioned the word obesity. So
Yes.
People like wondering about the obesity. Let's say it's an obesity pandemic all over
Yes,
the
indeed.
world. So will you please tell us how big is that obesity problem, especially in Kuwait?
It's a huge problem, and as you said, pandemic, because the whole world is affected, right? So for example, in 2010, it was estimated that 10% of the population had obesity. Now, in 2030, that estimate is about 17.5%, so almost double. But let's look at Kuwait. In 2030, it's estimated that 50% of women will have obesity.
Oh, that's huge.
It is, and 40% of men will have that. Now, when we look at children, the estimates say about 30%. So these numbers are scary because it means you will have lots of diabetes, heart disease, mechanical joint problems in the future. So it's a huge issue, especially in our region.
Definitely. Doctor, before, like a long time ago, people think about obesity as something to avoid by not eating a lot and exercising more and walking more and do a lot of activities. But nowadays, people are focusing more about how to avoid obesity and reducing the risk of obesity. So will you tell us more about it?
Yes, I think the first step is about awareness. Obesity was recognized as a disease in 1997. And the old mentality was just, shut your mouth and don't eat too much. And don't be lazy, go move, do some physical activity. Nowadays, we recognize it as a disease that's chronic, relapsing, and it should be viewed as any other disease, like high blood pressure, high cholesterol. You don't tell someone who has high blood pressure, you're lazy, go move. It's recognized as a disease and should be treated as such. So there are many factors involved in this disease, and most of it is unconscious. So it means subcortical level. You have in the brain centers for hunger and satiety. So many things influence these centers. Stress, lack of sleep, processed food, smoking, all of these affect your appetite and can lead to obesity.
Exactly. And also, Dr. Ahmed, there's a lot of people who want to go to take the shortcut when it comes to losing weight.
Yes.
So they might go to supplements, pills, any other things, just for them to sit and relax without making any effort to lose weight. So will you please tell us more about the supplements and the pills they might take and might be risky to their health?
Yeah. So we can view them in two different categories. So you have the medication that's been studied and approved for the indication of reducing weight. And these medications have been through many processes, different steps to make sure that the medication is both safe and effective. And there are a couple of them available on the market. But that said, we should still see a physician before trying these medications ourselves, because you might have a contraindication to this drug, or maybe the dose of the drug is too strong for you, So that's why it's important to see someone for these recognized and official medications. Now for supplements, it's a different story because these are not regulated. That means we don't know the long-term effects. Some of them have hidden components or maybe too much caffeine, thyroid hormones, which will have a negative effect on the body.
At the future.
And anxiety, palpitations. Some people even might, go into a heart condition, heart attack.
And everyone can take it without prescription.
That's the problem. It's not regulated, so you just walk in any store, you could buy it. Even online, you could buy these supplements. So my advice is to avoid them and speak to your physician if you want advice on what's FDA approved and what's safe to take.
Exactly. Dr. Louis mentioned obesity. We immediately recognize that there's diabetes that's related to it, like for increasing weight. So will you please tell us why diabetes is common in Kuwait, like it's spreading fast in Kuwait, and how do we prevent getting diabetes?
Okay, so as you said, there's a strong link between obesity and diabetes, such that some people use the term diabesity. So obesity and diabetes is diabetes.
Combined two words
exactly.
Together.
And that just highlights the role of obesity in this disease. So there are many factors in Kuwait that make it one of the highest in terms of diabetes percentage. There's genetics. We know genetics is involved.
Exactly.
The environment. The weather is very hot most of the time of the year, so people avoid going outside doing activities. They do most of the gatherings inside or in malls. And usually these social gatherings involve a lot of food.
Exactly.
So you have the environment, you have genetics, and all these, daily stress events. For example, we know that people who have disturbed sleep cycles are more likely to become diabetic and have obesity and all that.
Well, it's like something you mentioned, like a lot of people may not know, like the sleeping cycle might affect the diabetes.
Because it affects the hunger and satiety centers. And if you do it yourself, I mean, if you stay up late, you might feel like, you feel hungry despite having the 3 main meals during the day. You just, want to grab something to eat. And the problem is at 2, 3 a.m., you don't have many healthy options, right? Even if you want to order something, it will be some fast food, or grab chips or something like that.
Exactly, definitely. There's a lot of people who like to order pizza after midnight.
Yes,
mostly, or fast food.
And
also, doctor, we're wondering about many young people take hormonal products for body enhancement and performance, especially the people who want, or the person who wants to go to the gym and wants to get the muscle as soon as possible within 3 or 2 weeks. So what is the risks associated with this kind of behavior? It's dangerous.
It is, so when we talk about these drugs that are being abused by these athletes or young people, they could be categorized into like hormones, anabolic, testosterone derived, or growth hormones, or maybe even just protein, amino acids, creatine, and all that. So what's most concerning is the hormonal aspect, because once you take a hormone from outside, you affect the natural cycle inside the body, right? So for example, if you take testosterone or any of the derivatives, it might affect your natural production of testosterone. That will affect your sexual function later on, your ability to have kids. It might lead to also development of breasts in men. So all these effects can happen. Now, some people have read into the material and say, okay, I can take this for preventing infertility. I could take this for stimulating my natural, or restoring the natural cycle. That's true partially. But what you cannot restore is something like, for example, if you have heart enlargement, because heart is a muscle, and when you take these things to bulk up your muscles, the heart will also be enlarged, and that's not reversible. You can have problems later on in life, sudden death.
It'll be permanent.
Yeah, it'll be permanent. Also, psychological effects. If you take, for example, testosterone, big doses, you might become aggressive. That's probably why we see lots of fighting in the streets and So it is something that we're worried about, and we also always advise our patients and these young gentlemen to avoid taking these supplements, even if you say that I'm doing it with a coach or someone who is well trained.
Exactly. Well said, doctor, and thank you for being with us tonight on Hala Kuwait. Do you want to have any last word with our viewers who want to share something with them?
There's a nice saying that says you have to keep active to avoid aging and all these related diseases such as obesity and diabetes. So, keep active, move a lot, eat healthy, sleep well, and see your doctor when you're sick.
Well, thank you so much again, Dr. Ahmad, and wish you the best of luck with your future endeavors, and please enjoy your night.
Thank you very much. It was a pleasure.
Thank you. The viewers we just had with us, Dr. Ahmad Esmaeel, specialist in endocrine diabetes and metabolic disease. Let's go now to our second report of the evening. It's about Kids Art Workshop. Let's have a look at it, and we'll be right back. Stay tuned.